If you've got a horse that's got a one-sided nasal discharge, that's definitely a high alert for dental disease. So here's a tooth here that is fractured in half. And again, if we had smell-o-vision, this would smell really awful because this is all rotting feed in here, necrotic, decaying, rotting feed. We can have teeth like this. This tooth actually fractured during extraction. The root fractured off here. So just showing you, this is quite an old horse tooth, so it's not very long. This is only a 3 ml syringe, but for a lot of people, when we show them the horse's teeth, the first thing they say is, look how big they are. And I have to admit, when I go to my dentist, we have really great conversations and compare the size of our instruments because we use the same instruments. Ours are just supersized. We have an incisor here where the front of it's fractured off and another incisor here that is broken off. So for some of these things, you will be able to see with your eye, even if it's an untrained eye, just by flipping the lip. But for some of these other things that are inside the mouth, then you'll need a veterinarian's trained eye for that. Sinusitis or a sinus infection is something we see not uncommonly in horses. Usually, if it is dental related, it will be unilateral or one-sided, so it'll only be out of one nostril instead of both. And it'll usually smell pretty bad too, like pretty malodorous, pretty revolting, not something you want snorted all over your clothes. Horses don't like things trickling out of their nostrils, so they're really good at snorting it everywhere to clear that. And you just don't want to be standing in front of them to be the unlucky recipient of that. When you take x-rays of these horses, x-rays are a really important part of dentistry. You'll see these lines in here. So inside both our heads as well as horses' heads, there's big air-filled cavities. And this line that you can see here is pus. It is fluid pus inside those big cavities. And it's only until it gets to a point where you'll actually see it overflowing and start coming out their nose. So pretty yuck. If you've got a horse that's got a one-sided nasal discharge, that's definitely a high alert for dental disease. Then we've got some other things like caries, and we're going to go over this pretty quickly because it's just in 30 minutes, it's just impossible to cover all the pathology that is inside a horse's mouth. But there's two types of caries you can get, or cavities is the other word for it, and it's the main reason that we will go to the dentist. You can get caries on the outside of the tooth here, on here that's all black and sticky, or you can get caries within the tooth. So this is the upper cheek teeth here. This disease is much more common, at least in Australia. It's much more common in horses in Western Australia because they have a very sandy environment and they're supplemented with hay, and that hay tends to be very sweet. So I think there's a better understanding these days in that sweet hay. It's like McDonald's, like the kids really like it, right? But we know it's really not very good for them. Sweet hay is the same sort of thing. The horses really like it, so they'll gobble it up, but it's really not very good for them.